What if the medication sitting in your medicine cabinet right now, the one your doctor prescribed to keep you healthy, is actually sabotaging your sex life, and you have no idea it's happening? New research shows 5 incredibly common medications are causing erectile dysfunction in millions of men. And number 3 on this list, over 100 million Americans take it every single day. I'm Dr. Elizabeth Rains, urologist with 15 years helping men navigate these exact issues. Today we're breaking down which medications destroy sexual function, why they do it, and most importantly, what you can do without stopping necessary treatment. Because here's the reality. You shouldn't have to choose between being healthy and having a sex life. Now, I think we both know your doctor probably never mentioned these sexual side effects when writing your prescription. But understanding them changes everything. Before I dive into the list of medications, I want you to understand that erections come through a complex process. They require good blood flow, healthy hormones, and responsive nerves, and all of these can be disrupted in different ways. Here's what happens during a normal erection. You see something, hear something, feel something that turns you on. Your brain sends signals that cause blood vessels in your penis to relax, allowing blood to rush in, get trapped, and voila, you have an erection. But here's where medications can interfere with this process in 3 different ways. First, cardiovascular disruption. Some drugs reduce blood flow to the penis. Think of it as trying to fill a balloon through a kinked garden hose. It simply won't work well. Second, nervous system interference. Some medications mess with your nervous system, so those signals between your brain and penis get disrupted. The message gets garbled. The response weakens. Third, hormonal alteration. Some drugs can alter your hormones, particularly testosterone, which is essential for sexual desire. And if you're not desiring sex, getting an erection becomes significantly harder. Now here's the context. Most men watching this are already on prescription medication. In fact, 60% of men have taken at least 1 prescription in the last 30 days. And 1 in 5 men takes 5 prescription medications daily. So, let's talk about the study that revealed which medications are the biggest culprits. This research analyzed data from 3,000 men taking prescription medications and found they were 80% more likely to experience erectile dysfunction compared to men not on any medications. Even after adjusting for factors like education, BMI, other health conditions like diabetes, high blood pressure, and smoking, this remained true. But they didn't just find correlation. They used an advanced genetic analysis technique called Mendelian randomization analysis, which essentially strengthens that correlation to be closer to causation. So these medications aren't just associated with ED, they're actually causing it. Now let's count down the 5 biggest culprits, and I guarantee at least one of these will surprise you. Number 5, atenolol. This is a beta blocker, one of the most commonly prescribed medications for high blood pressure and heart protection. Atenolol works by slowing down your body's sympathetic nervous system, which lowers blood pressure and heart rate. That's excellent for your heart, but here's the problem. The same process makes it harder for blood vessels in your penis to relax and open up. And since you need good blood flow to achieve an erection, this medication essentially interferes with that process. The irony here is significant. You're taking medication to improve cardiovascular health, which is also essential for erections. But the medication itself is blocking the very function it's supposed to protect. About 25% of men on beta blockers experience some degree of erectile dysfunction. Number 4, simvastatin. This is a statin, a cholesterol-lowering medication. And statins are among the most prescribed drugs in the world. These medications are extremely effective at preventing heart attacks and strokes, but they can interfere with testosterone production. Here's why. cholesterol is actually a building block for testosterone. When you dramatically lower cholesterol levels, you can inadvertently reduce testosterone production, which leads to lower libido and erectile problems. Now, this is relatively rare and usually only seen at the highest doses, but it happens. If you're worried about this, get your testosterone levels checked rather than stopping your statin, because the cardiovascular benefits usually far outweigh the sexual side effects. Number 3, aspirin. Yes, regular over-the-counter aspirin that millions of people take every day. This one surprised even me. Research shows chronic aspirin use might cause ED, possibly because it affects nitric oxide, which is essential for erections. Nitric oxide is the signal that tells blood vessels to relax and open. Now, don't panic if you're on daily aspirin. The cardiovascular benefits of aspirin often far outweigh the risks. But it's important to know this connection exists. Talk to your doctor about whether your daily aspirin is still necessary. Guidelines have changed in recent years about who should take it. Number 2, atorvastatin. This is another statin, and it works the same way as simvastatin. It reduces cholesterol production, which can affect testosterone levels. Again, managing your cholesterol, heart disease, and blood pressure are critically important for erectile function long-term. High cholesterol damages blood vessels, which makes erections weaker over time. So while the medication might have some sexual side effects, uncontrolled cholesterol would cause far worse problems eventually. The key is finding the right balance with your doctor. Number 1, metformin. This is the go-to medication for type 2 diabetes, and this one is particularly tricky. Why? Because diabetes itself is a major cause of erectile dysfunction. Almost 50% of men with diabetes experience ED due to nerve damage and blood vessel damage from high blood sugar. But research suggests metformin may have additional risk. It affects vitamin B12 absorption, which impacts nerve function. And nerve function is essential for sexual response. Metformin may also affect testosterone levels in some men. Now, before you consider stopping metformin, understand this clearly. Uncontrolled diabetes will cause permanent nerve damage, leading to irreversible ED. The medication protects you from far worse outcomes. Now, speaking of supporting testosterone and sexual function, there's something critically important most men don't know. 90% of your testosterone is made while you sleep, and there's a specific vitamin you can take before bed that dramatically enhances this production. I have a video breaking it down. Watch it after this one. All right, let's talk about what you should actually do with this information. Before you rush to your medicine cabinet and throw everything away, take a deep breath. That would be dangerous and potentially life-threatening. Here's what you need to understand clearly. The conditions these medications treat, high blood pressure, high cholesterol, diabetes, are far more dangerous to your overall health and sexual function than the medications themselves. Uncontrolled diabetes causes permanent nerve damage, leading to irreversible ED. Untreated high blood pressure leads to strokes. High cholesterol causes heart attacks. These medications are literally saving your life. But here's what you can do. First, talk to your doctor honestly. Be completely open about sexual side effects. There are often alternatives. Many medications work just as well with fewer sexual side effects. For example, you can take ACE inhibitors instead of beta blockers, or switch to a different statin formulation that affects testosterone less. Second, optimize your lifestyle. This is probably more important than medication changes. Regular exercise, healthy diet, quality sleep, and stress management all improve sexual function dramatically. And here's the best part. These lifestyle changes often allow you to reduce medication doses or eliminate some medications entirely. Managing stress is particularly important. Everyone lives in highly stressful environments these days, but working on stress reduction can be incredibly helpful for both your overall health and sexual function. Third, consider timing or dosage adjustments. After talking to your doctor, you might be able to switch when you take medications or reduce the dose slightly without compromising health benefits. Fourth, don't ignore the problem. If you're having sexual side effects, this is critically important. Erectile dysfunction is often the first warning sign of cardiovascular problems. It frequently presents long before heart attacks. Many men with ED will develop heart issues later. Recognizing ED early, talking to your doctor, and getting evaluated is a step in the right direction. I'll tell you something. Most of my patients with erectile dysfunction become incredibly motivated to improve their overall health. This is your opportunity to turn your life around. Take it seriously. Let me bring this together clearly. These 5 medications, atenolol, simvastatin, aspirin, atorvastatin, and metformin, are linked to erectile dysfunction through solid scientific research. But stopping them without medical guidance would be far more dangerous than the sexual side effects they cause. Here's exactly what I want you to do. First, schedule an appointment with your doctor specifically to discuss sexual side effects. Don't be embarrassed. This is a medical issue, and your doctor needs to know. Second, ask about alternative medications with fewer sexual side effects. There are often multiple options for the same condition. Third, commit to lifestyle improvements. Exercise, diet, sleep, and stress management. These aren't optional. They're essential for both medication management and sexual function. Fourth, get a complete cardiovascular evaluation. Remember, ED is often the first sign of heart problems. Addressing it now could prevent serious issues later. If you found this information helpful, hit that like button right now and subscribe for more evidence-based health content. Share this with anyone dealing with medication-related sexual issues. These conversations need to happen more openly. Before you go, remember that video I mentioned about the vitamin to take before bed for testosterone production. 90% of your testosterone is made during sleep, and supporting that process properly changes everything. Don't skip it. I'm Dr. Elizabeth Rains. Your sexual health matters just as much as your cardiovascular health. Both deserve attention and care. Thanks for watching. Stay strong, and I'll see you in the next video.